What I'm going to talk about now is based on our research on a study of 1,386 participants with spinal cord injury. What did we find as far as risk factors for early mortality after spinal cord injury? And I'm going to go through each set of factors as we identified them. What you currently see on the screen is our risk model. It relates biographic and injury characteristics, psychological variables, environmental variables, behavioral variables, health variables to mortality after spinal cord injury. As we look at the model, we are now going to show the actual risk factors that we've identified in our research, and we're going to start with health factors. You'll now see in the blue box that 5 variables have come up. And what we have found that people who have been hospitalized, people who have a history of fractures and amputations, particularly amputations, symptoms of infections, things like sweats, chills, urinary tract infections, and surgeries for pressure ulcers, and probable major depression. Those are all risk factors for early mortality. And what essentially that means is, again, people who need to be hospitalized because they've had severe concerns and that have had, again, amputations, infections, history of depression, history of pressure ulcers. Those are the most prominent of the health factors that we have identified in our study. And next we'll look at behavioral factors. And the things that we have identified that lead to a greater risk of mortality are prescription medication used for sleep, spasticity, pain, and depression. It's overall amount of use. So it's not a particular medication. Doesn't mean everybody that takes that type of medication is going to have early mortality. But overall, there's an increased risk of mortality among people that use prescription medication. Binge drinking is another one. Binge drinking is defined by 5 or more drinks on occasion. So people that do more heavy drinking or binge drinking are also more likely to have early mortality. Hours out of bed, that is actually a protective factor. People that spend more time out of bed tend to live longer. They tend to be healthier, more active, and people that smoke are at a greater risk for early mortality. The next set of factors we're going to look at are psychological and environmental factors. And 2 psychological factors have been related to early mortality after spinal cord injury. And they are sensation-seeking and neuroticism anxiety. And actually sensation-seeking is a trait that occurs among people who like to take risks, chances. A lot of people who had their initial spinal cord injury, it was during high-risk activities. Certainly not everybody, but it is related to this characteristic. And if people continue to do high-risk activities, their likelihood of long-term survival after spinal cord injury becomes diminished because the same activities can also put them at risk. Neuroticism anxiety, people that have more difficulty coping are going to have trouble with early mortality. And then lastly, purpose in life. This is a protective factor in that people who have purpose in life, people that find something to wrap their arms around, whether it's employment, family, church, volunteer activities, but something which drives their life in a positive manner, they tend to live longer. Among the environmental factors, we've identified 2. And the first is income or poverty. And the reason that we treat this as an environmental factor is that it's what we would call a proxy variable, or something that would indicate other factors. And those might be access to good health care, ability to pay for nutritional items, to have a healthy diet. All these things are purchased by income, having a good income. And people that live in poverty are particularly likely to have early mortality after spinal cord injury. And then the last factor is social support. People who have good, strong support in their communities from their families, they are likely to live longer. So this is a summary of the research model that we use, a summary of the factors that we've identified in relation to early mortality after spinal cord injury. The factors we've identified are the most important in each group. I'm going to advance the slide one more time, and what you see now is a simultaneous analysis of everything across all levels, with the exception of biographic and injury factors, and the ones in gold lettering are the ones that, even among the important factors, are the most important. I'm going to talk in the future about life expectancy, preserving life expectancy, and just how these factors relate to actual longevity.